Hello everybody, welcome to YT King of Random. Today we are gonna go through world's top 10 illnesses. But wait, when we think of top 10 illnesses, most of us think of some severely gross and vigorous diseases which would act fast and have its effect within few days and kill us in weeks. But no, almost all of these are related to our lifestyle and our fitness regime and the kind of food we put into ourselves. These progress slowly in us until they show their final effect. So this makes it important for us to maintain a healthy lifestyle and take all the good measures to prevent ourselves from being the patient of one of these diseases. So enough for the intro, without any further ado, let's get started with the video. Number 10. Cirrhosis disease. Cirrhosis is a late stage of scarring or fibrosis of the liver caused by many forms of liver diseases and conditions such as hepatitis and chronic alcoholism. It took almost 1.2 million deaths and 2.1% of deaths are due to this particular disease. The death rate has increased from 905k to 1.2 m from 2000 to 2015. So what are the risk factors and preventions for this disease? Talking about the risk factors, the chronic alcohol use, non-alcoholic fatty liver and chronic viral hepatitis are the risk factors. Prevention: don't drink alcohol, maintain a healthy diet, avoid shared needles, razors and toothbrushes. Number 9. Tuberculosis. Tuberculosis or TB is an infectious disease usually caused by Mycobacterium tuberculosis bacteria or MTB bacteria. Tuberculosis generally affects the lungs but can also affect other parts of body. Most infections show no symptoms, in which it is known as latent tuberculosis. It took almost 1.3 million deaths worldwide, and which 2.4% are due to this particular disease. The death rate has decreased from 2.3 million to 1.3 million from 2000 to 2015. The risk factors and preventions. The risk factor includes Mycobacterium tuberculosis infection, HIV infection, low body weight, proximity to other TB. It also includes taking of corticosteroids or immunosuppressant drugs. The prevention of this particular disease includes vaccine of BCG, maintaining a proper hygiene and taking a proper diet. Number 8. Diarrheal disease. Diarrhea is usually caused by a virus or sometimes contaminated food. Less frequently, it can be a sign of another disorder, inflammatory bowel disease or irritable bowel syndrome. Diarrheal disease is the second leading cause of death in children under 5 years old. It is both preventable and treatable. It took almost 1.4 million deaths, and about 2.5% deaths are due to this particular disease. It has decreased from 2.2 million to 1.4 million from 2000 to 2015. Talking about risk factors, poor sanitary conditions, no clean water, malnourishment and weakened immune system are some of the risk factors, and the preventions include healthy living conditions and balanced diet only. Number 7. Alzheimer's disease. It is a progressive disorder that causes brain cells to degenerate and die. It is the most common cause of dementia, a continuous decline in thinking, behavioral and social skills that disrupts a person's ability to function independently. It took almost 1.5 million deaths worldwide, and 2.7% of deaths are due to this particular disease. It has increased from 1.2 to 1.5 million from 2000 to 2015. Talking about the risk factors, being older than 65, family history, inherited genes, mild cognitive impairment, Down syndrome, unhealthy lifestyle, being female, and any previous head trauma leads to this disease. Talking about the preventions, healthy diet and more vegetables and fruits can only lead to the prevention of this particular disease. There are no preventive measures. Number 6. Diabetes mellitus. It is commonly known as diabetes. It is a group of metabolic disorders characterized by a high blood sugar level over a prolonged period of time. Symptoms often include frequent urination, increased thirst, and increased appetite. If it is left untreated, diabetes can cause many complications. It took almost 1.6 million deaths worldwide, and 2.8% of deaths are due to this particular disease. This disease has increased from 1 million to 1.6 million from 2000 to 2015. Talking about the risk factors, excess body weight, high BP, older age, not exercising, and unhealthy diet leads to this particular disease. Talking about the preventions, regularly exercising, having a good diet, and taking less amount of stress can lead to the prevention of this particular disease. Number 5. Trachea, bronchus, and lung cancer. It originates from the right lateral wall of trachea at the level of more than 2 cm above the tracheal bifurcation. The patients usually are asymptomatic, but some may experience recurrent pneumonia, chronic bronchitis. It took almost 1.7 million deaths, and around 3% are due to this particular disease. It has increased from 1.2 million to 1.7 million from 2000 to 2015. Risk factors include smoking, tobacco, family history, environmental factors like pollution. The preventive measures include the avoidance of all the risk factors mentioned above. Number 4. Chronic obstructive pulmonary disease. Chronic obstructive pulmonary disease or COPD is a chronic inflammatory lung disease that causes obstructed airflow from the lungs. Emphysema and chronic bronchitis are most common conditions that make up COPD. Damage to the lungs from COPD can't be reversed. It took almost 3.1 million deaths worldwide, and 5.6% deaths are due to this particular disease. The death rate is consistent from 2000 to 2015. Talking about the risk factors, smoking plus secondhand smoking, lung irritants and chemical flames, family history, childhood history of respiratory infections lead to this particular disease. Preventions include stop smoking, avoid secondhand smoking or lung irritant, and medications and treatment can lead to the prevention of this particular disease. Number 3. Low respiratory infections. Lower respiratory tract infections are any infections in the lungs or below the voice box. These include pneumonia, bronchitis, and tuberculosis. A lower respiratory tract infection can affect the airways, such as with bronchitis, or the air sacs at the end of the airways, as in case of pneumonia. It took almost 3.2 million deaths worldwide, and 5.7% of deaths are due to this particular disease. From 2000 to 2015, it has decreased from 3.4 to 3.2 million. They can be due to influenza, pneumonia, bronchitis, or tuberculosis. Talking about the risk factors, flu, exposure to lung irritants, smoking, weak immune system, asthma, and HIV can lead to this disease. Preventions include immunization and vaccination, no smoking, hygiene, and balanced diet. Number 2. Stroke. It is referred to as the damage to the brain from interruption of its blood supply. A stroke occurs when the blood supply to the part of your brain is interrupted or reduced, preventing brain tissue from getting oxygen and nutrients. A stroke is a medical emergency and prompt treatment is crucial. Stroke almost took 6.2 million deaths worldwide in 2015, and 11.1% worldwide are due to this particular. The death rate has increased from 5.7 million to 6.2 million from 2000 to 2015. Talking about the risk factors, high BP, family history, smoking combined with oral contraceptives, high in African and Americans, high in female. These are the risk factors. And talking about the prevention, healthy lifestyle, control BP, no smoking, exercise, and low sodium diet can prevent this disease. Now it's time for number 1. The most dangerous disease in this whole world is ischemic heart disease or coronary artery disease. It is a condition of recurring chest pain or discomfort that occurs when a part of heart does not receive enough blood. This condition occurs most often during exertion or excitement when the heart requires greater blood flow. It almost took 8.8 million deaths worldwide in 2015, and 15.5% deaths are due to this particular disease. It has increased from 2000 to 2015 from 6 million to 8.8 million. Talking about the risk factors, high BP, high cholesterol, smoking, family history, diabetes, and being overweight are the risk factors, and the preventions include exercising regularly, healthy weight, balanced diet with low sodium diet, drinking moderately, or avoiding drinking can prevent this dangerous disease. So we need to get a lifestyle fixed and live a healthy life. If you like this video, give it a thumbs up, subscribe to our channel, and see you in the next video. Till then, have a good day. See ya.